Hi, I'm Jason May from Nursing Quality, and today here I have with me Amanda Miley from the WOCN team to talk a little bit about pressure injuries. Amanda, can you tell me what we're seeing today with hospital-acquired pressure injuries?
Sure, absolutely. As you guys all probably know at this point, our hospital is seeing a lot of really sick individuals. Since COVID, our acuity continues to see more acutely sick patients with problems that are keeping them here in the hospital longer. So, as with any other kind of chronic health issue, we're seeing issues arise with skin, and we're hoping this video will actually address some of the issues that not only nursing but our PCTs have when it comes to how to best document and report skin issues as they arise.
And speaking of documenting, can you tell me about the 4 eyes and 4 hours assessment and why that's so important?
Yeah, absolutely. So 4 eyes in 4 hours is an acronym that describes when 2 licensed staff go in and do a complete head-to-toe skin assessment on a patient at admission, specifically within 4 hours, when they come out of the operating room, or if there's a transfer in level of care. So for example, the patient transfers from a med-surg unit to the ICU unit where they're requiring more care. So what they do is they do a full head-to-toe skin assessment, and then there is a smart phrase in Epic where they can document those skin assessment and any of those exceptions that they may see, specifically pressure injury points.
Okay. Well, one of the things I also notice, and specifically speaking for myself, is I can't tell the difference between something that's potentially a pressure injury or just a bruise or something like that. How do we differentiate?
Yeah, that's an excellent question, and a lot of people have that same question, and there's confusion for sure. Our team also struggles with it from time to time, and we like to coordinate and kind of talk about those patients as well. For the bedside nurses and for the techs, the best way that I can think to describe a deep tissue pressure injury would be an area of purple, non-blanchable, meaning if I touch it, the redness or the purple skin does not go away when I touch it, and it is over a bony prominence. So that would be your coccyx, your sacrum, your heels. Sometimes it can occur on the back of the head. Pressure injuries tend to be round or oval in shape, and if you palpate those areas, you can sometimes notice a change in the way the skin feels. Like for example, deep tissue injury over the sacrum a lot of times will feel harder than the surrounding intact skin. Bruising, it does look very, very similar. Usually though, you can correlate that with a fall, for example. It doesn't have to be over a bony prominence. If you had a patient who fell and they landed on their right side, that bruise could be on their arm. Also, it tends to be more irregular in shape and it will change color, whereas a deep tissue pressure injury will typically stay purple in color for several days.
Well, thank you. That's really helpful. And one of the things I'm hearing is a red flag would be a wound over a bony prominence. So if you're seeing that and you're questioning that, reach out to your nurse clinician, your charge nurse, or if in doubt, just go ahead and consult the WOCN team.
Absolutely. We would rather have a consult or just a quick phone call saying this is something that we're concerned about. We can come by and take a look. A lot of times what we'll do is actually photograph the area of concern and monitor that over the next several days to see if it turns into something.
Okay.
Yep.
Well, thank you so much, Amanda,
You're
for your
welcome.
time. And don't forget to do your 4 eyes and 4 hours assessments, and let's stop these pressure injuries. Thank you.